welcome back to Simply Women's Health with CJ. Today we're going to talk about the implantable contraceptive. There is only one product on the market. It is a 4-centimeter device. It looks like this, although it is white, it is not green. It goes up into your arm and provides 3 years of reliable birth control with the hormone progesterone. The job of the progesterone is to thin out your uterine lining. It tells the ovaries to stay asleep for the most part, and it thickens your cervical mucus, making it hostile to sperm. This device is 99.8% effective for contraceptive benefit. Notice I did not say 100. The only way that I can absolutely promise you will not get pregnant is if you stop having sex or you become a lesbian. Otherwise, if the penis and the vagina are in the same room, there's always a chance for pregnancy. Now, when we do this procedure, there are risks: infection, bleeding, pain. That's the triad that's associated with almost everything in medicine. There is a risk that the device could be put in too deep and you would have to have it removed under ultrasound guidance. Some potential side effects: the vast majority of women will have irregular bleeding with this device. Remember, I said it thins out the uterine lining. The way it's going to do that is with you bleeding. If 5 different women get Nexplanon, one of them stops having periods altogether. Everyone wants to be her. 3 of them will have irregular bleeding. It may be 3 times a month, it may be 3 times a year, and one of them never stops bleeding, and after 6 months requests that the device be removed. Approximately 10% of patients will request removal of the device due to dissatisfaction with the bleeding. A small percentage of women will have increased acne, a small percent will have some weight gain, and a small percent of women will notice changes in their moods. These are small percentages, but they exist nonetheless. So you have decided that you want to get a Nexplanon inserted. You're going to go into your provider's office. I usually counsel my patients to not have unprotected sex for 2 weeks prior to Nexplanon placement. You come in, they will want to do a pregnancy test, and then your provider should counsel you, and then you'll sign a consent giving them permission to do the procedure. You're going to lay down, you're going to put your arm up, and they are going to find their landmarks on your arm and figure out exactly where we want to put the device. Once they have found where they're going to put the device, they're going to clean your arm off with some kind of an antiseptic solution. They're going to numb your arm up. Ironically, the numbing part is the part that hurts the worst. Once your arm is numb, they will insert the device, and then they will bandage your arm up, and you'll be on your merry way. The procedure itself is actually very quick. It's the counseling and the talking part that does take the longest. After you get your device, if you start having pain at the site, redness, swelling, foul-smelling discharge, if you're running a fever, you will need to let your provider know. I usually counsel my patients to use some form of backup, like condom backup, for the first week until the body has absorbed enough of the progesterone to be effective. Please keep in mind that this device does not prevent sexually transmitted infections. So if you are in a relationship that you're not 100% sure that you're not at risk, I recommend condom backup. I usually recommend condom backup anyway, because 2 forms of birth control are always better than 1. If you feel as though this device is right for you, do not hesitate to reach out to your provider and see if that is appropriate, and if it is, go ahead and get this device placed. Hi, if you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement for a visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.